8:32 now. Welcome back to Fox News Rising. I'm meteorologist Sarah Blake here with a very important issue. Many parents, they're undecided about getting their teen girls the HPV vaccine. Today's Presbyterian House Call with Dr. Karen Horne will answer some questions about Gardasil as well as HPV. Good morning to you, Karen. Thank you so much for joining us here this morning. So quickly, yeah, we appreciate you being here. You know, this became a big topic of discussion with Gardasil started their mother-daughter commercial. So first kind of talk about HPV, and then we can get into Gardasil.
Okay, well, it's important to know that most of the cervical cancers are caused by HPV. There are certain strains of the virus that will definitely cause cervical cancer as opposed to genital warts or just plain warts anywhere else on the body. 16 and 18 are the two strains that cause cervical cancer. By getting vaccinated against those strains, you're more likely to reduce your risk of getting invasive cervical cancer.
And so if you're getting the vaccination from Gardasil, does this help everyone, or does this just help children or adult women or men? Kind of explain who this vaccine is truly for.
Okay. In 2006, the FDA approved Gardasil for all women between the ages of 9 and 26. Ideally, we like to vaccinate women before they ever have their first sexual intercourse because we want to get the immunity on board before they're exposed to the virus. After that statement in 2006, the American Academy of Pediatrics came out with a statement saying that they would ideally like to vaccinate all girls 9 to 11 years old, once again, to make sure they have the immunity before they're exposed to the virus. In this day and age, a lot of girls are getting vaccinated, but some people are still getting missed. And I see plenty of women in my OB clinic who still need Gardasil, even in their 20s. As of now, insurance companies will cover it until the age of 26. Once a woman turns 27, it's no longer covered. So we really try to reach out to everybody to get Gardasil while they can still get it. After the age of 26, it's still safe. It's still been proven to be effective. However, there's an insurance problem as far as getting it covered. But even women in their 30s and 40s, newly divorced women who will be dating again, all of these folks can still benefit from Gardasil. As far as vaccinating boys, the studies were performed in men and women, and it was shown to be proven safe and effective for men and women together. As of now, there's no national recommendation that specifies that boys should be vaccinated. That may be coming in the future, but as of now, if a boy were to be vaccinated, it would be considered off-label. However, it would still be safe to do.
Okay, and this virus is spread by men, though, correct?
Correct.
So obviously, is it something that you would recommend as a doctor? Okay, go ahead. I'm sorry, go ahead.
It's important to know men never show signs of having the virus. It's almost impossible to know which guys are carrying it because they don't show signs. And when a woman gets the virus, it can stay in her body for years before she starts having abnormal paps. So most women never know who they received the virus from.
Okay. So is there any reason not to get this? It seems like a positive thing to make sure that our kids aren't going to have to worry about cervical cancer. Is there a negative to this vaccination?
Not that we've been able to find so far, and the studies have been performed for years and years before it was ever marketed to the general public. The most common side effect of getting the vaccine is just pain at the injection site. Since it's relatively new, we don't know for sure how long the immunity will last. It looks like it is lasting for many, many decades. But as of now, we're not sure if a booster shot will be needed in the future. And those studies are still ongoing. But there's really no reason not to get the vaccine since it is safe and it is to prevent cervical cancer.
All right. Well, Dr. Karen Horne, thanks so much for joining us here this morning. We've got knowledge and hopefully prevention for all those moms listening to help with the fight of cervical cancer. Thank you again for answering our very own house call, Karen.
Thank you.